Hi, my name is Tripp. I am a general surgeon with CHRISTUS Trinity Clinic. Grown up in Cypress, Texas, you're active in football, and then also my family had some property out in the hill country of Texas. So pretty much if I wasn't on the football field, was spending time out there, working the land, and just being out in God's country. So my father was probably the man who had the biggest influence in my life. He was the best man in my wedding. He's my best friend. And getting to watch the way that he raised his family, the way that he loved his family, had a huge impact on me. And it wasn't even just what he did with his family, it was what he did with his community. He was a pillar for his community. He was a large figure and very central to his church. And really he lived the kind of life that I hope that I can live. Patient safety is first and foremost, and so making sure that in all scenarios and in all settings, the patient is receiving the safest possible approach to their care. If that means coming in the middle of the night as opposed to waiting in the morning, that's absolutely the first thing we would consider doing. And I think the second most important part is communication. So it's twofold, and part of that is me listening to the patients and understanding exactly what is going on, what their fears are, what they have going on in their normal day-to-day life that we need to get them back to as soon as possible. To be able to go through and communicate all the treatment options, and if surgery is an option, then discuss the risks that are associated with that, so they have a complete understanding of what goes on in the OR. And so really the main focus is just making sure the patient has a complete understanding of what needs to happen for them to get back home.